Most patients tend to feel some pretty good results within a week or two. People tend to see chiropractors between 1 and 3 times a week, depending on the doctor and depending on how they work. Oftentimes people with mood disorders see chiropractors less frequently. They have a lot to process and a lot to work through on their own, and so oftentimes once or twice a week is more than sufficient for them to continue healing and to start that process. And so within a couple weeks, oftentimes their symptoms, the depression, the anger, oftentimes comes out a little bit more. And so those experiences are manifested bigger for a few weeks. But there's also an underlying sense of stability and an underlying sense of grounding that while there is a lot more sadness or more anger or more emotion, there's also a stronger sense that that isn't defining them anymore. That's no longer defining their experience, that they can have an emotional experience that doesn't wholly consume them. Coming to a chiropractor for a mood disorder is not an either or. You don't see a chiropractor or see a psychotherapist. What we need to do is figure out what works best for you in that point in time. Oftentimes I work with a psychotherapist because I'm not trained in that talk therapy. I'm not a mental health care provider. And that's really important to get the help you need wherever you can find it. What I help people do is listen to their body better, is to process through what they're learning and what they're experiencing in other parts of their lives.